Prostate cancer: the best treatment options. Prostate cancer is a disease in which malignant, cancer, cells form in the tissues of the prostate. Signs of prostate cancer include a weak flow of urine or frequent urination. Tests that examine the prostate and blood are used to detect, find, and diagnose prostate cancer. Certain factors affect prognosis, chance of recovery, and treatment options. Prostate cancer is a disease in which malignant, cancer, cells form in the tissues of the prostate. The prostate is a gland in the male reproductive system. It lies just below the bladder, the organ that collects and empties urine, and in front of the rectum, the lower part of the intestine. It is about the size of a walnut and surrounds part of the urethra, the tube that empties urine from the bladder. The prostate gland makes fluid that is part of the semen. Signs and symptoms. These are signs and symptoms may be caused by prostate cancer or by other conditions. Check with your doctor if you have any of the following: weak or interrupted, stop and go, flow of urine, sudden urge to urinate, frequent urination, especially at night, trouble starting the flow of urine, trouble emptying the bladder completely, pain or burning while urinating, blood in the urine or semen, a pain in the back, hips, or pelvis that doesn't go away, shortness of breath, feeling very tired, fast heartbeat, dizziness, or pale skin caused by anemia. The condition is called benign prostatic hyperplasia, BPH, and although it is not cancer, surgery may be needed. The symptoms of benign prostatic hyperplasia or of other problems in the prostate may be like symptoms of prostate cancer. Tests: physical exam and history, an exam of the body to check general signs of health, including checking for signs of disease, such as lumps or anything else that seems unusual. A history of the patient's health habits and past illnesses and treatments will also be taken. Digital rectal exam, DRE, an exam of the rectum. The doctor or nurse inserts a lubricated, gloved finger into the rectum and feels the prostate through the rectal wall for lumps or abnormal areas. Prostate-specific antigen, PSA, test, a test that measures the level of PSA in the blood. PSA is a substance made by the prostate that may be found in an increased amount in the blood of men who have prostate cancer. PSA levels may also be high in men who have an infection or inflammation of the prostate or BPH, an enlarged, but non-cancerous, prostate. Transrectal magnetic resonance imaging, MRI, a procedure that uses a strong magnet, radio waves, and a computer to make a series of detailed pictures of areas inside the body. Biopsy, the removal of cells or tissues so they can be viewed under a microscope by a pathologist. The pathologist will check the tissue sample to see if there are cancer cells and find out the Gleason score. Transrectal ultrasound, a procedure in which a probe that is about the size of a finger is inserted into the rectum to check the prostate. The probe is used to bounce high-energy sound waves, ultrasound, off internal tissues or organs and make echoes. The echoes form a picture of body tissues called a sonogram. Transrectal ultrasound may be used during a biopsy procedure. Prostate cancer treatments. Surgery. There are currently 2 ways to get the job done. The first is with traditional open surgery, which involves making an incision in the lower abdomen. The second is with minimally invasive surgery, where the surgeon uses special instruments to perform the operation through a handful of tiny keyhole-sized incisions. Robotic-assisted surgery is a type of minimally invasive surgery that is becoming an increasingly popular option. External radiation therapy. Radiation therapy involves using high-energy X-rays or particles like protons to kill cancer cells and shrink tumors. These days, it's becoming a more refined science than simply point and shoot. A typical course of radiation involves 40 daily weekday treatments over 8 weeks. Scientists are currently investigating the safety of administering higher doses of radiation in fewer treatments. Internal radiation therapy. If schlepping to the hospital 5 days per week for 8 weeks to receive external radiation sounds like the biggest commitment you've made since marriage, you could have the radiation come to you with brachytherapy. Here's how it goes down. In a 90-minute outpatient procedure, while you kick back under general anesthesia, your surgeon uses a long, thin needle to implant 100 or so radioactive seeds, each about the size of a grain of rice, throughout your prostate.